Let's move on to our next drug. That's going to be the drugs that are in the hallucinogen class. So for example, that'll include LSD, which stands for lysergic acid diethylamide, and then psychedelic mushrooms, or shrooms for short. As a disclaimer, I have not used either of these drugs. However, I do have friends that have, and the stuff that's floating around in academia that I'm about to teach does kind of correlate with some of the symptoms that they say they experience. So of course, when you think LSD or a hallucinogen, I want you to think visual hallucinations. So you may be seeing things that other people wouldn't see. You also can get perceptual disturbances or perceptual changes. What do I mean by that? Could be the room is bigger than it actually is, or the room is kind of closing in on you. Your perception of the world changes. You can also get delusions and also pupillary dilation. So what's another word for pupillary dilation? It'd be mydriasis. Meiosis is when your pupil constricts, and mydriasis is when your pupil dilates or gets bigger. Then also another side effect that you could see with an acute intoxication of LSD, for example, would be an increase in your senses. You're able to smell better, you're able to taste more, you're able to feel more, you're able to see more. So that's why when you think LSD, hallucinogens, that's why you get those colors. You can perceive colors differently. You have heightened awareness, you have heightened senses. These are some of the side effects that you'll see with an acute intoxication of LSD or hallucinogen. So we just talked about the acute intoxication, what you would see in LSD. Now let's move into the long-term symptoms. These long-term symptoms you typically don't hear about, but you can get a thing called hallucinogen persisting perception disorder. So hallucinogen persisting perception disorder. And what it is it's a feeling where you're completely sober. Let's say 40 years after you use LSD for the very first time. You're sitting in your basement. You know that you're sitting in your basement. You know that the year is 2040, let's say. You know that where you are. You know you're in the basement, but you get some visual hallucinations just out of the blue. They can last up to a minute, but you can gain complete insight into knowing where you are and your experience. That could be an example of hallucinogen persisting perception disorder, and it is a long-term consequence of hallucinogen use. You can use LSD only once in your lifetime, and years down the road, you can get this thing called hallucinogen persisting perception disorder. So let's cover the highlights. Mostly visual hallucinations. So auditory hallucinations are not going to be seen on hallucinogen persisting perception disorder. They're going to be visual hallucinations. Remember, for LSD use, a lot of the hallucinations are going to be visual. So it's the same thing. It's a visual hallucination. However, these can last minutes. You're going to be completely sober at the time that this happens. So if you just took LSD, no, you're not having hallucinogen persisting perception disorder. You're having an acute intoxication of LSD. However, if you're completely sober and you get these visual hallucinations, this is what you have. You're going to retain insight into the event. You're going to know exactly where you are, exactly what's going on around you. You know that this visual hallucination is not due to some other substance, it's due to the past use of a hallucinogen like LSD. Now, although most end after 5 years or so let's say you had LSD 5 years ago, most people will stop experiencing these visual hallucinations, this hallucinogen persisting perception disorder, after 5 years, but sometimes it can lead up to 40 years, it's been documented. So it's something where one-time use of LSD can have this lasting effect on your body. How are you going to treat this hallucinogen persisting perception disorder? Well, you're going to use a long-acting benzodiazepine, such as clonazepam. So I'm just going to write it over here. That's about all I have to say for that. All right, then lastly, let's go to our withdrawal symptoms. Hallucinogen withdrawal is beautiful because there really is very mild to no documented withdrawal symptoms. So long-term use of LSD, all of a sudden you stop. Well, you can get that long-term sequelae, the hallucinogen persisting perception disorder. However, you won't really have the withdrawal symptoms that you would typically see with alcohol, cocaine, benzodiazepine, heroin, all the opioids. All that can present with some pretty nasty withdrawal symptoms. LSD and the hallucinogens are different. They're really not going to have a good side effect profile for withdrawal. So